guest speakers are Professor Hamid Rashwan, who is the Chief Executive of the International Federation of Gynecology and Obstetrics, and Professor David Taylor, who acts as the FIGO Logi Initiative Project Director. I just leave the word to Professor Rashwan to introduce this very important initiative of FIGO. Please.
Thank you, Diego. Thank you for coming. And this project which we are going to introduce to you is the largest project that FIGO has ever done in its history. We started it about 3 years ago, officially in Cape Town, I think, in 2009. And it's a project aiming to improve maternal and newborn health in low and middle resource countries. But this time not by engaging in activities related to the maternal and newborn health services, but we thought that we have got very strong people in the field who are the obstetricians and gynecologists who work in societies and who have got good clout in the country where they can make a change in the policies, and they are not utilizing it. In most of these countries we have got societies, national societies of obstetrics and gynecology, which are not strong enough to pursue any sort of activities. So it was decided that the best way forward is to strengthen these societies. And we got a grant from the Bill and Melinda Gates Foundation to pursue doing this process. So Professor David Taylor will tell you more about the project and its objectives and activities. But I just want to say that we have chosen only a few countries which need this activity and this support from a number of other countries which are really looking for the same. And we found that during this period there has been an immense change in the culture of these associations, in their activities, in their output with regard to policies and improving the practice of clinicians. And we feel that it was, in general, a successful project, a very successful project. And also it's not going just to end, it has to end in 2013. This is the project time frame. But it's going to leave also legacies which Professor David Taylor will tell you about. So we have been, I think, very fortunate to get this support, which made us contribute to our member societies in low-resource countries to make them effective organizations in promoting maternal and newborn health. And I leave the floor to Professor David Taylor.
Thank you very much, Hamid. Can you hear me? My voice is soft, so I have to be careful that you can hear me. As Hamid said, this project was launched in Cape Town 3 years ago. In 8 countries, 6 in Africa and 2 in Asia. All the countries have high maternal mortality rates and high newborn mortality rates. Some of the countries, women have a chance of dying in childbirth of 1 in 10 or 1 in 20, huge risks of going to pregnancy and having a baby. As Hamid said, there were organisations, professional organisations in each of these countries, but their activities were limited. They would run annual scientific meetings like this meeting that FIGO is having in Rome, where new knowledge is shared amongst their colleagues. They might have some educational workshops during the year, but that was the limit of their activities. We wanted them to be stronger and work with governments and influence maternal and newborn health policy. So we've strengthened the organisations, governance arrangements, management arrangements, financial arrangements, communication with their members, and communication with other organisations, other professional organisations, UN agencies, and with government. All the organisations now have regular opportunities to engage with their governments to discuss maternal and newborn health plans, and they've influenced improvements in maternal and newborn health within their country. I don't know whether you know, but the majority of reasons that women die in pregnancy and childbirth are amenable to simple interventions. Relatively simple. It's not high-tech end of medicine. They need what we call a skilled birth attendant to be with them at birth, obstetrician, midwife, nurse, skilled individuals. And they need access to blood transfusion, to antibiotics, so relatively simple interventions. And the problem is that money has not been allocated to maternal health services in these countries. But we've recently had a success in Uganda where the government has increased the allocation to reproductive health by 30%. So that's a huge new investment in reproductive health, partly the result of our organisation in Uganda. They've been involved in developing what we call guidelines, setting standards for how doctors, nurses and midwives should deal with common conditions that cause maternal death, like bleeding around the time of childbirth, very high blood pressure that's called preeclampsia and can lead to fits and convulsions called eclampsia, infections, women having difficulty delivering babies, we call that obstructed labour, and they need caesarean section, and caesarean section is not very accessible in these countries. So there have been a range of activities that have been developed by strengthening these organisations of obstetricians and gynecologists who have huge knowledge to be able to inform governments and their ministries about how to improve maternal and newborn health. And the evidence from the project is it is worthwhile investing in these skilled professionals, and you can have impact in countries very quickly by investing in our colleagues in countries and low-resource countries. So that's my initial overview.
When discussing about this, I have a question. While you think about your question, while discussing with you about this initiative, you said that one of the aims is to extend the impact of this initiative beyond the limits the initiative has in terms of probably countries involved. Are you thinking of involving other countries or repeating the experience or something like that within the time from now on?
Yes, the project of course has to be limited because funds are limited by any donor that we get. So we started with 8 countries, as David mentioned, 6 in Africa and 2 in Asia. But the plan was to expand this project, if possible, to other countries which do need. And we have a lot of requests from these countries who would like to get the same treatment as these lucky ones who had this project. But unfortunately, the funds are not easy to get. And but we will try and expand it through South-to-South collaboration. So those countries which have been capacitated and strengthened will work somehow with the other countries in trying to push them up a bit and scale up the process. Of course, it's not easy. Of course, we have legacies left behind the project, like putting a toolkit in in the website, which gives the associations which are not having enough capacity, how they can do this capacity building if they follow that toolkit. So it is available on site, and of course dissemination of information also will be ongoing in the website regarding how they can be strong societies.
Thank you. Any question? No, I thought you were